Present for the meeting, the member may ask the chair of the board to request that another board member, not a member of that committee, attend the scheduled meeting and be counted as a member for purposes of quorum and voting. And that did in fact happen. Sally Hernandez Pinheiro has requested Suzanne Miles Gustav, who will be represented shortly, hopefully, by Erin Kelly as a voting member. And Dr. Ted Long will be representing Dr. Katz and will be in voting capacity. We'll hold off on minutes, I guess, until we get quorum, and we could actually, though, begin with our presentation, our first one, which is going to be an action item. And Kendra Ford, do you start off for us?
I will. Good morning. My name is Kendra Ford, Senior Vice President, Clinical Services Operations. Good morning, everyone. I'd like to invite the Harlem team to the table, please. If you could please, George, introduce your team.
Certainly. Good morning. My name is George Lacone. I'm the CEO from Harlem Hospital.
Maurice Wright, CMO.
Art Cooper, I'm Director of Pediatric Surgical Services and Pediatric Trauma Services.
And Dr. Calamia and Dr. Spagano, we would like to proceed with a resolution for Harlem to move forward with a pediatric trauma certification. Do I go ahead and read?
Please.
All right. Approving the application of New York City Health and Hospitals Corporation for verification of the American College of Surgeons, the ACS of New York City Health and Hospitals Harlem, as a Level 2 pediatric trauma center, and committing to maintaining the high standards needed to provide optimal care of all pediatric trauma patients, and that the Multidisciplinary Trauma Performance Improvement Program has the authority to evaluate care across disciplines, identify opportunities for improvement, and implement corrective actions, and authorizing the appropriate officers of the system to execute any and all documents necessary to verify Level 2 Pediatric Trauma Center designation for Harlem through the ACS Committee on Trauma.
Super.
If you'd like to go ahead and talk about it.
Sure. Thank you for the opportunity to be with you this morning. You'll note on the map that's being displayed that we as a system have 6 trauma centers. 2 of those are currently verified as pediatric as well as adult trauma centers. Harlem is applying for that designation as well at this time. Next, please. The standards we're required to meet are set forth in what's known as the Gray Book, formerly known as the Resources for Optimal Care of the Injured Patient. All hospitals are asked by the American College of Surgeons to meet these standards. There is a survey that follows upon the application to achieve a trauma center status, and at this time, in the post-COVID years, the survey is actually remote rather than on site. It's a very rigorous process, and we were actually last reviewed in 2022, and the upcoming survey is expected to verify us as a Level 2 pediatric trauma center for the Harlem community, and put us on the same 3-year cycle as all the other trauma centers in the system. Now, the New York State Department of Health accepts the American College of Surgeons verification process for a hospital to become designated as a trauma center. It's sort of a deemed status similar to Joint Commission. And the Optimal Resources document, as the Gray Book is informally known, is codified by reference in the New York State 408 Health Code regulations, and these have now been adopted by the state. Now, New York State hospitals are not recognized as trauma centers unless they've been verified by the American College of Surgeons Committee on Trauma, which is why we're here to see you today. There's a subtle rule change that took place this particular year, and it's in fine print on the left, but and highlighted. But the main issue is that in the past, one simply applied for verification, and the college determined what level you would be verified at based on a number of factors. But in this go-around, the standards have changed, and the college is requesting that applicants for verification specify the exact level of verification that they're seeking, and that needs to be specified in the governing board resolution. Now, research and scholarly activities are only absolutely required for level 1 trauma centers, but you know, it's certainly a good thing if you're a level 2 center and you're able to demonstrate scholarly and research activities, but it is not a requirement at the level 2 level. We all, however, have to do community outreach and specifically trauma education. Harlem is the largest center for providing ATLS teaching in the region. We also provide Stop the Bleed training for the community, and all centers really have to train the next generation of trauma physicians who are working with them, residents in EM, surgery, and other specialties. And of course, all hospitals are required to participate in a performance improvement and patient safety program, so-called PIPS programs. But they report to the hospital PI program overall. Now, the operating rooms have to be available within 15 minutes with the ability to open a second room if necessary. There has to be a capability of dealing with orthopedic trauma. That's especially important in children because, you know, more than half the operative volume for children is orthopedic. Blood bank has to be immediately available. Radiology, including MR, within 2 hours, IR within 1 hour, and of course, other special equipment is required for the trauma registry, which documents the outcome of each patient. So again, as Ms. Ford read to you a little bit ago, this is our request that the committee approve.
All right, and Jose, and I'm as well, so you passes unanimously. Thank you for the presentation.
Thank you so much.
Appreciate that. Also, I could use this time to ask for approval for the minutes of the last meeting. So I'm going to go around again. Proof. Excellent. Proof. And Aaron. So again, unanimously approved. All right, thank you much, and let's begin our reports now. Welcome, Kenra. It's congratulations, A, on your new position, and B, on giving your first report. So.
Thank you for the warm welcome and good morning, everyone. Again, I'd like to bring Dr. Pulitzer. Dr. Pulitzer leads our enterprise-wide teleradiology as chief of the program. We'd like to provide this morning a very high level of the work that's being done across the enterprise as it relates to further expanding our radiology program and bringing together 11 programs that have been operating at a hospital level now as a enterprise program. High level, Dr. Pulitzer, introduce yourself, please, and begin.
Thank you very much. Stephen Pulitzer, I'm the System Chief of Radiology for New York City Health and Hospitals. We go by the title of Enterprise Radiology. So in the next 5 minutes, I'm just going to give you an introduction of what we do, how we do it, why we do it, and hopefully by the end it will be clear. So I put up a slide of a Toyota Land Cruiser. And the reason I put this up is that it's one of the most reliable cars, a reliable car company. And what we're trying to do here in health and hospitals for radiology is become a very reliable partner. So I want you to just imagine if that car was made in 7 different countries using 7 different types of production lines, everybody sources their equipment and raw materials separately. You know, when you get to the, if there's a problem, it's very difficult to go back and figure out where that problem is because everything is not done uniformly. So what we're trying to do here is create a uniform system so that we can streamline how we do radiology and what we, if there are problems, we can go back, fix them, and become more efficient. And so in the beginning, you know, our radiology departments, some of our radiology departments were production lines like this, and we can go to the next slide. Some were very high tech, like this one. Others were, very much a hands-on operation. And next slide. And some were just, one-person shops, right? Like we'll do it all. And then in the extreme, we weren't even doing radiology. We weren't even making cars, we're making boats, right? And so how do we decide to now move forward? So next slide, please. So what we did on the left was representative of when we took over and started the radiology program. We were a bunch of independent pieces, all working in different areas and trying to get to the point on the right where we are moving all in the same direction and we have some uniformity. So the first thing we did was we worked on trying to get coverage 24/7. There was a lot of variability in our ability to provide coverage to the emergency rooms and stat inpatient studies after hours. This was costing a lot of money because people were using very different ways to do it. Some were using outside vendors, some were using vendors, their own staff. And so the second phase of what we're doing is about productivity. So the efficiencies that we're trying to get with the 24/7 coverage, and we move that now into the subspecialties, the Tour 2 during the day, trying to make each member more productive, bring in systems that we can have everybody work to their full capacity, and then through efficiencies, we can start to grow. And that brings us into phase 3, where now that we have 24/7 coverage, it's consistent, we have people working very efficiently, we're able now to get 1, 2, or 3 more patients on the exam tables of each of our pieces of equipment, and those would be unique patients. And so I think that's the way that we can grow. It's not necessarily by having more centers and more people, it's by becoming more efficient and making our use of our equipment and our use of our workforce in line so that we can now grow in place. So some of the, the next slide we can go to. So some of the issues that happen during the day, what we did was we created a daily metrics dashboard, and this goes out to all of the C-suite individuals, all the radiology chiefs. What usually happens is somebody will call and say, my exam was delayed. And it's very difficult to figure out if it was delayed because we didn't get the patient there in time, or if it was delayed because we got the patient there in time and it wasn't read on time, or if there was just a crazy amount of volume that day and everything got delayed. And so very simple metrics, and this way we can actually fix the issue. If it's a transport issue, if it's a radiologist issue, or if it's just normal variability, and there's nothing we can do about it. So the last thing that this brings me to is all of the things that we've been doing have been about operational efficiency and getting people to into the department, through the department, getting their exams read, getting the quality up. But nothing has really been about, the most important question. And the most important question, I feel, is when a patient comes in and says, why should I get my care with you? What is it about your institution that I should put my trust in you? And so I think that we can answer that question very well. And if we look at this slide, it's just a representation. On the bottom is a 5-year survival curve. And the yellow bar on the bottom is stage 4. The purple bar is stage 3. And I can say that, doing the work that we've been doing at one of our hospitals, which will be taking those procedures and moving them throughout the health system, 10 years ago, most of our patients, good majority of our patients would show up at stages 3 and 4 and have a very poor outcome. Over the past 10 years, with systems we've put in place in terms of community outreach, patient navigation, improvement in equipment, improvement in efficiencies, and expanding our access to patients, now the majority of our patients are coming in at stage 1 and stage 2 and have a much more meaningful treatment plan, and their 5-year survival is high. And so I really do think if we get coordinated and we put our processes together, all of that operational work that we're doing now will pay off with a community benefit of improved health. So thank you.
Thank you. Questions? Just so I get a sense, so this is all obviously work in progress, and how far along are we? How And at the end point, I mean,
Sure.
I do want to ask you a couple of questions when we're to that point about
Uh-huh.
how this system looks, but how are we time-wise?
Yeah, if we can go back to the slide with the productivity, one more back. In phase one, we're finished with phase one, and I'm just because I can see from here. Okay, so, um, what we've done in phase one, we got everybody onto one platform. We utilized our IT platform, which is a single use of PACS, and we also have a EITS platform that goes across the system. With that, we were able to provide more complete and uniform coverage. Our volume increases in the ED and stat inpatients about 10% year end over year end. And we were able to not only meet that volume, but we were able to meet that volume and only add about 4% to the budget after taking away sessional spend, after taking away vendor spend. And so we feel that going forward, what we can do is continue to, our biggest paradigm shift was when you have 11 hospitals, you tend to staff toward coverage. And you might have more individuals than you have volume. And so with our single platform, our paradigm is that we're going to staff to volume across the system and not to coverage, since we can do this remotely, mostly in the after hours. And so we anticipate, 20 to 30% decrease in size of the departments as a whole if we're working together and working across the system. And so we've seen that reduction, and we've seen success in phase one, which is 4 p.m. to 8 a.m. And now we're in the phase two, where we're working on becoming more efficient during the day.
So at the end point, I know you also talk about Gotham and ambulatory sites and so on. So at the end point, are all of the studies going to be reached by a group who are doing this and hopefully maybe through AI or whatever? Comments? Super, thank you so much.
Thank you very much. Have a great
Appreciate it.
day,
Thank you.
everybody.
All right, and now we have our Chief Nursing Officer report, Dr. Sineas.
Sure. Good morning. I'm pleased to share a report from October 2024 to April 2025. We had held a special fireside chat focused on our new career ladder for ancillary staff, focused on PCAs, PCPs, and BHAs with the goal of becoming nurses. So far, we've had over 200 applicants with the goal of launching this program at CUNY in the fall. We also, next slide please, held the 16th iteration of our fireside chat focused on medication administration, where we've had over 300 nurses dial in just to ask questions about medication administration, which we will be following up on. Next slide. We also held a third annual virtual celebration for Respiratory Care Week. The theme was Journey Together, Impact Forever. Our keynote speaker was Dr. Lopez. It was a wonderful event. We celebrate respiratory therapy every year. Next slide. We were also able to launch our 5-year strategic planning retreat for nursing. It was a multi-day retreat held November 21, 22, and December 2nd and January 13th. The keynote speaker for this event was Mark Bertrand. Next slide, please. You'll see some photos. We had over 160 nurse leaders across our system come together to really develop the strategic plan, which we're really excited about. Next slide, you see Dr. Allen, Dr. Fatal, and Dr. Way, who were present and really helped just have great dialogue around maternal morbidity and our focus on behavioral health and also quality. Thank you. Next slide. We also held our Nursing Excellence Awards on December 17th. We honored 35 nurse professionals. 25 nurses were recognized for excellence in clinical nursing. 5 nurses were recognized system-wide for their efforts around leadership, volunteering, education and mentorship, home or ambulatory care, and technology and innovation. 5 nurses received the Daisy Award, Nurses for Advancing Health Equity. We also handed out special awards, such as the Structural Empowerment Award, presented to Queen's leadership and staff. The 5th annual Josephine Bolus Nursing Champion Award was bestowed upon Dr. Sharon Pappas. And lastly, the Josephine Bolus Shining Light Award, a new award, was given by her son, Michael H. Bolus, to 5 units who embody the values of compassion, dedication, and excellence in the nursing profession. Next slide, please. You'll see some images there. Dr. Katz is front and center supporting our nurses every year, and it was a wonderful event. Next slide. A Beacon Awards, which is one of the designations within nursing, was awarded to Metropolitan on January 30th, 2025. We had over 100 people in attendance. CEO Julian John and CNO Christopher Wilson were in attendance, followed by remarks by Andrew Wiltrich and also Armin Poor, Dr. Poor. Next slide, you see some images there. Really proud of our 1,600, which is remarkable, with hundreds and hundreds of nurses studying for their certification exams, which is a hallmark of nursing practice. We had Jennifer Graby from the ANCC come as our keynote speaker to celebrate with us for Certified Nurses Day. Next slide, please. We also held our Fall and Injury Prevention Summit. This was the third aspect of our Fall and Prevention Summit. We were able to roll out the Behavioral Health Fall Prevention Bundle, which is the first ever in our system. We look forward to reducing falls and falls with injury within the behavioral health service line. We have a new evidence-based practice tool that we just rolled out, and this was all really facilitated by our nurse leaders and also frontline staff. So we're really excited about disseminating this work externally as well. Next slide, please. Just a couple more awards. Queens Hospital received the PRISM Award last April. Really proud of 4BE unit. So now Queens proudly joins the other 105 units in the country and 3 hospitals in New York State to receive this prestigious award. Next slide, please. Queens also received the AORN Award for surgical safety. There you see some images of our Queens team, really proud in a conference getting this award because they received the AORN Go Clear Award as well. Lastly, just want to talk about our fellowship programs, which were launched to ensure that new nurses are practicing safely in our critical care spaces. And so our ED fellowship program continues to be the #1 fellowship program with over 389 nurse fellows completing their 6-month fellowship program. The intensive care unit program, also 67 nurse fellows. And lastly, our newest fellowship program, the perioperative program, with 17 nurses completing their 6-month fellowship program there. So just really proud of all our nurse educators and all of our nurses who have embarked their nursing career in critical care settings, which is really, really hard. So that concludes our report for October 24 until April 2025. Thank you.
Super, thank you so much. Any questions or comments?
For the strategic planning, I saw the pictures and how it lasted like 3 days or a couple of days. I wanted to ask you if sort of like, is it complete now, or and also does it get deep into staffing needs over the next 5 years when it comes to
Great
nursing?
question. So we were just blown away, the attendees, because I have personally been here for 6 years, and the first strategic planning retreat, Dr. Katz was present, Dr. Way was present, and when we reviewed the previous 5 years, we had completed everything we set forth to do despite COVID-19. So we're so proud of ourselves. So with this next strategic plan that we just put together, we use lean methodology, so Hoshin Connery, which is the ability to look at the responsibilities of all aspects within nursing. So the chief nursing officer, the directors of nursing, the associate directors of nursing, down to frontline staff. So what is everyone's roles and responsibilities as it relates to executing our strategy? So within that, everyone has a responsibility within staffing. So, you know, my role is looking at external partners, partnering with CUNY, and then we look at the director of nursing's role as it relates to staffing, the ADN's role as it relates to staffing, and then the frontline staff, making sure that they're, you know, kind to their peers. And so with all of the tactics, we aligned it with who is responsible. So we're really excited about it, but staffing is embedded within the nursing strategic plan. There are a multitude of things that we are focused on, but it's really exciting. And so what we do now is on a quarterly basis, just look at how are we performing and are we on track.
Thanks.
Any other comments?
I was just going to say, in line with what Dr. Pagan was saying, recruitment of staff across our system is such a challenge, but just seeing everything coalesce, the multitude of different interventions you've made here, and seeing the success is really amazing. I've been here for my 8th year, and it's one of those problems of, can we recruit the doctors and nurses we need, but you've done a terrific job here,
We
so.
recruit over 4,000 nurses in a
That's
year.
amazing.
So we have 400 nurses on orientation and very few vacancies right now. And so the goal is retention. So during our next report out, we'll talk a little bit about the new retention strategy that we're working on.
Great, thanks.
Super, thank you so much. Appreciate excellent report. All right, let's go on then to Chief Information Officer report.
Thank you
Mendez.
for calling me. I'm Kim Mendez. I'm the CIO for New York City Health and Hospital. I'm joined here with my colleagues, Dr. Michael Boughton, who is our Chief Health and Medical Informatics Officer, Apoorva Carrier, who manages all of our finances and contracts, Jeff, who is our Chief Technology Officer, and Shoma Badori, who's our CISO, Chief Information Security Officer. As with Natalia's report, this also covers a large period of time, so we will keep it, high level and contained. I'll just kind of go through the agenda, and then we'll pick out a couple key pieces to dive into a little tiny bit. So in the report, you will see that there is DNA Innovations and AI Service Line. In December of 2024, the DNA team and innovations and now AI actually came under EITS before it was under quality, as you might recall. With that, there is a new leader. Her name is Divya Pathak. She is now the Vice President and Chief Data and AI Officer. One of the first things that she did when she came in December of 2024 was, it was December 2023, I apologize. She was here 1 year in December 2024, my mistake. It was to take a review and do an assessment of the current DNA program. And indeed she did, and one of the key outcomes of that was looking and making an assessment about the DNA champions, which are individuals who reside at each of our facilities to help with some of those reports and develop a new operating model. In addition to that, she has put together a plan for this new AI service line, which is really just in its very infancy and kicking off. One of the key components of that is governance. We see that very similar to technology in general, what is the security review, what is the business case, the budget, etc. So we will hear more on that. That's actually a future topic for us, and she will join us and provide some of that information as well. Innovations falls under that area. Thank you for who turned the slide there. And part of what Andrew Bogoda is doing on this team, which has a really powerful enterprise impact, is the policy management system. So that very similar to having Epic, we will have a policy management framework that will be enterprise-wide, and we're very excited about that, as well as developing their key 2025 objectives and key results, which is the OKRs. We can move a couple slides down, and then Dr. Boughton, I'm going to have you speak. Is very proud of where we are with our Epic Honor Roll.
So this is a program from our electronic medical vendor, Epic. This is the third year in a row that we've achieved honor roll status. This basically is, are you adopting the features and utilizing them that have proven effective at all of the other customers that use Epic, which is at this point more than half the hospital beds in the United States. Just to give you some context, about 18% of their customers achieve this in any given year. And having achieved this 3 times, I think, is a real achievement and really speaks to the teamwork that goes on. And this is very much not just an EITS project. In order to get these features on and working and utilized, we need partnership from the ambulatory care group. We need partnership from the perioperative space. This is an IT-focused thing, but it could not have been done without partnership from the entire system.
Yeah, really great achievement. You will also see, which I won't dive into, but that we are getting ready for a new upgrade, and one of the components actually of Honor Roll is making sure that you stay up to date on the new platform innovations that are coming. And so we'll be most up to date in about a week. We can move.
How seamless do they tend to be, these updates? They always scare me, but anyway.
I think we have gotten it. Oh, Lord, I don't want to jinx it.
I'd say the fact.
A
couple of years ago, our downtime window that we allowed ourselves was 4 hours. Our published downtime window that we can expect is 2 hours, and we are generally coming in underneath that.
Yeah. We really have matured in this area. So, and we not only have we matured in just the functionality, we can move to the next slide. We also continue to add on new areas within our Epic electronic health record. One is Epic Care Companion. Without going into it, this is really ensuring that we have a most appropriate education aligned with patients, and this can be given at the after visit summary, when individuals are leaving, just using TED as an example from ambulatory care and other areas across the hospital. We can move to the next slide. In addition is leveraging our patient portal, which is MyChart. Hello World is one of the areas that we are in this digital space, leveraging so we can send out messages, reminders, and you'll have the ability to, if you have an appointment in a month and you want to try to get an appointment earlier, you can put your name on a waiting list. These have all been moving very well and in a positive direction as we continue to expand the adoption of all the functionality within Epic. Moving on through our health information technology, this is our it's enterprise-wide large projects, that we are involved in. One is the integration of the B-Braun infusion pumps. This is the first time we're actually integrating it into Epic, which will really save a lot of time, for documentation, et cetera. We can move to the next slide. Here, Oracle Cloud, which is, as you all know, is the new payroll system, but it's not just payroll. This is also going to, it's a multi-year project that will include transitioning from PeopleSoft for HR onto Oracle Cloud. The first stop in 18 to 24 months will be the payroll system and also the scheduling system. Next slide. We can go to the next slide. And here's one of our strategic initiatives that we started over the summer of 2024. This is the Unprint. And I can say that we've done a lot of progress in this area. We began with actually just understanding people's awareness, and putting a new website in place to remind people. You can see it's a 5-year project on the very bottom. We're only just a few quarters in, but we're making good progress. We started with just awareness, putting the campaign together. Then we came into central office and we had a collaboration with all the different service line leads here. And then once we completed that, we started actually at all of our facilities. And the goal around the facilities is not to do every facility big bang, is to focus on high print areas. So we started at all the facilities with the administrative offices, and then we'll move to the HR offices. And HIM is also a very large print office, our service line. We can go to the next slide. Wanted to show you some of the progress. We do this in 2 ways. One is the total volume that we have for our focus has been on black and white and color printing, and then you can see in the bottom right is the total. I started this in October to not double dip on any kind of cost savings, because we actually did, you might recall here at this committee, we did our contract and we were able to pull some of our rates down. So we actually had an innate contract, cost savings. But this is above and beyond what we did, and that contract started in October of 2024. So that's why I started the baseline here at October 2024. Even with that, you can see both with the different, the color and the black and white printing, the total volume. This is across the entire system, has had a nice progression down, even though we were focused right on central office for the first quarter or so, October, November, December. We can go to the next slide. Here is central office specifically, where you can see a lot of the work has been done here, and a lot of the savings has been a steady, down decline. Anywhere where it had a little pop up here, we're trying to investigate, well, what happened there? Why did that go up? Is there something, that, drove those increases in printing? We can go to the next slide. We wanted to leverage April for Earth Day and put a challenge into place. So I'm kind of excited to see what happens next month when we get the numbers back from in this month in May, from all of April and some of the work we did there. This initiative, which is the 5-year initiative, is actually reported at the strategic committee of the board. So we will get an ongoing update on how we're doing with this quarter over quarter. And I think I'm going to close with just highlighting, if I'm right, if we can go to the next slide. Oh, sorry, virtual agent. We can go to the next slide. The graph tells the story, although the colors are too close. But if you just look at the first area here, central office, all chats, agent chats, bot chats. So all chats is all of the enterprise support services where they are having a conversation with someone who needs assistance. And we have leveraged within our system a virtual agent that can help you do some of the, investigation and give you the solution without ever having to talk to a human being. And so what has happened, enterprise support services. So this has really helped with some of the easier, solutions.
Can I ask you a quick question on that? Like do you know when something is solved? Like if there's a bot chat, do you know that the problem was solved and then just transferred to the agent?
So we do get to understand if it is not, there's a timing on it. If the virtual agent does not resolve it, then there's a, I don't know the exact time, it gets escalated up to a live agent to support the recovery of whatever the problem is. I could bring that data though, that would be interesting.
I was just
He
curious to
asked,
see
he
how.
asked, did this solve your problem? And if you say no, then
Is that what you were asking for?
Yeah,
Oh, I'm
I was
sorry.
trying to understand. I mean, as I'm sure all of you have used these systems, it can get really frustrating. And I was just curious about
And
how we know.
there is also at the end, if we say we fixed it for you and you might not think that it's fixed, everybody gets a request to say, did we solve your problem? There's a quick little survey. It has like 5 faces and different, smiley faces on it that you can easily choose, did we solve your problem? There's an area for a comment as well. And that actually has been, just to give you the consumer, the user satisfaction, national average is about 85% for enterprise support desk. We actually benchmark against ourselves. We're either between 92 or 95% consistently for the last year or so. So I'm happy to bring other, data, but I think, overall it's been a successful program. The last slide is just, continue please, is just looking at individual recognition. Our EITS radiology support team, as well as an individual, Arquette from DNA, as well as Dan Mackel, have received nominations or an award. Actually, Dan actually received the city's OTI Hayes Award, which was a really, scholarly, and I think he was one of there was like hundreds of people who had actually they were looking at for this award, so we're very proud of that. And the last slide shows during the winter, we did our first coat drive for our facilities. We actually took them over to different hospital ambulatory care. So that was Patricia Ruiz and team, and we just want to thank all of them, and thank you very much. How we do.
Questions?
Just one quick comment. I think it's really interesting to see, like when with Epic, we weren't the early adopter of Epic, but it's, even though we got Epic later on, we're on a roll 3 years in a row, and it's a rare day for me in clinic where I have a patient that's not on my chart. Like we've locked in on it and knocked it out of the ballpark. So just, kudos to the ITS team. It's really incredible to see what we've been able to do. My patients feel the impact.
Thank you very much.
Thank you. Appreciate it. All right, that's for our last report, and that'll be our Metro Plus Health Plan, and Dr. Sanjeev Shah will be representing Dr. Schwartz today. Thank you.
Good morning, Dr. Calamere, Dr. Pagan, and the board. Very happy to present this update. Next slide, please. So the first section is on membership. As of March 31st of this year, MetroPlus has close to 692,000 members across 10 or more plan offerings. It represents a growth, as you can see, of over 150,000 members since January of 2020, and an annual growth of 1.5% since April of last year. One thing to make note of is that there has been the unwind, the public health emergency unwind, which means that members in both Medicaid and the Essential Plan have to redetermine themselves, provide their financial documentation, other demographic documentation, and to maintain the growth during that time period is, I think, a testament to the work of both the sales team and the documentation team to ensure that people don't lose their health coverage in Medicaid and the Essential Plan. The largest membership percentage growth among H&H facilities was observed at Harlem Hospital. So in terms of a regulatory update, many of you might be aware of New York State's adoption of a single fiscal intermediary This is the intermediary that helps members who are approved for consumer-directed personal assistance services or CDPAS services that helps individuals who qualify with activities of daily living such as dressing, bathing, housekeeping, and meal preparation. If you designate a friend or a member of your family to be your personal assistant in that benefit, you have to go through a fiscal intermediary to get paid. There were hundreds of fiscal intermediaries, and now New York State has adopted a single intermediary. Their name is PPL, Public Partnerships LLC. And as a result of that adoption of a single FI that was supposed to go live of April 1st of this year, everyone had to re-register themselves, the individual member, and their personal assistant with PPL. That was supposed to go live, as I mentioned, April 1 of this year, but there was then a court order that was submitted on behalf of the existing fiscal intermediaries. And as a result of that court order, now the individual has until May 15th of this year to register with PPL, and the personal assistant, the designated individual member or the family or friend, has until June to register with PPL. There has been a lot of work done by plans, including MetroPlus, to ensure the registration process occurs. Even though you would expect there's an incentive for people to do so, doing so was not straightforward working with PPL. And so the plan, MetroPlus stepped in and helped register these individuals, both the individual member and the personal assistant. Next slide, please. And 85% of members are now registered, and about 70% of personal assistants, and that figure is rising. But the most important fact is that 100% of the people who are receiving significant services, several hours a day of services, have all been registered with their personal assistants. Moving over to quality, MetroPlus, I mentioned already the Essential Plan, has over 150,000 members in this plan offering. It's the second largest plan to Medicaid. There are 5 aspects of the Essential Plan, EP 1 through 5. Since 2021, the state instituted a Quality Incentive Award recognizing the rise in membership in the Essential Plan across the state. For measurement year 2021, the state retrospectively reviewed plans performances in this plan offering, and of the 5 tiers, tier 1 being the highest, tier 5 being the lowest, MetroPlus ranked in tier 3, right in the middle. But we did institute performance improvement strategies, and for measurement year 2022, we achieved the 2nd tier, and just announced as of March of 2025 by the New York State Department of Health for measurement year 2023, we are now at tier 1, one of only 3 plans achieving that ranking amongst the 16 plans that are part of the Essential Plan statewide. Next slide, please. So this doesn't come by chance. It requires a lot of performance improvement strategies, working closely with health and hospitals, but also with community providers, understanding that 65% of the primary care providers in the Essential Plan are amongst the community providers, not at H&H. The quality management team, really the architects of this success, working closely with H&H Central Office, contacted each of the acute facilities in Gotham, as well as with community providers, have really taken a holistic approach amongst the myriad of measures, 7 of which are in the behavioral health space. So it's a large component, not just in the physical health side, but in the behavioral health space too. And we've achieved this tier 1 ranking across a gamut of measures, including member satisfaction. 20% of the points are achieved through CAP surveys that are done every year amongst the membership, randomly selected for that work. And we've achieved an increase in that area too, which has been an Achilles heel of the plan compared to the clinical measures that we've always done well in. So this is a huge clinical, sort of impact of the plan, reputational impact, of course, a huge, obviously, benefit to the members and their providers, but there's also dollars associated with this in the millions of dollars as a result of the fund that's been set up to reward quality performance in the essential plan that is of benefit to H&H as part of the risk arrangement. And then finally, focusing, I believe, on breast cancer screening as a clinical measure. Obviously, everyone recognizes, with the earlier presentation today, the impact of breast cancer screening, the importance of it. We've worked very, very closely with colleagues at H&H and with community providers who give radiologic services to improve outcomes in breast cancer screening. It is also a measure that's been selected by New York State, along with cervical cancer screening and colorectal cancer screening, to focus all plans' efforts as a result of the public health emergency ending and recognizing the fact that during the emergency, many people fell behind in their cancer screenings and immunization screenings. And so it's a performance improvement project designated by the state. Just one mention here of the guidance just announced literally a few weeks ago. Both HEDIS, which regulates the federal level through NCQA, has announced that breast cancer screening now will move the age parameters from 50 to 74 to 40 to 74, recognizing the changes in the United States Preventive Services Task Force, lowering the age at which women should receive their first screening up to the age of 74. So that's going to be a challenge across the board, but that's been adopted by centrally, and I suspect will be adopted by New York State too, for measurement year 2025. Next slide, please. So in an effort to improve our performance, we have worked closely with H&H community providers. You can see the plan achieved the 90th percentile. That means we're the top 2 ranking plans in the state of Medicaid, but we're falling behind in the essential plan. As I mentioned, this was takes a concerted effort to improve performance. We believe for measurement year 2023, where I just mentioned that the plan achieved the tier 1 ranking in the essential plan, we went from below the 50th percentile to above the 50th percentile, which means that we're now in the top 8 plans of the state, and we think that for measurement year 2024, the results of which will be submitted in the next week, we've seen a 5% year-over-year improvement in our work. Next slide, please. Obviously, this does, again, not occur. It's a very strong collaboration through sending messages, including through MyChart, to folks at H&H, but also with community providers. We work closely with the Office of Women's Health at H&H, Wendy Wilcox, Kendra Ford, and colleagues. 2 facilities which had been poorly performing have actually increased their performance remarkably year over year. The first being Harlem at almost 12% increase in their breast cancer screening rates, and the other one being East New York, achieving an incremental improvement. We've also ensured that supplemental data, that's data for individuals who may have received their screening outside of H&H or other systems, that we incorporate that information both through EPIC as well as through the RIOs. That's an important mechanism to ensure that women are not over-screened if they've achieved a screening elsewhere. We're also working to ensure through MyChart messaging that the message gets across. And we do want to recognize the great help of the H&H call center. Andrew Kobosowski and Arsenio Gonzalez run that. We've supplied 4 staff to that work. They do outreach calls before the primary care visit, ensuring that women get alerted to the need for mammography and then to ensure that that takes place. It's also coupled with a robust member rewards program that is incentivizes members to both get the mammogram and then achieve a financial reward through a credit card with dollars added to it, both for Medicaid and the Essential Plan. Next, please. And then in terms of messaging members, we have a current vendor, mPulse, but we've now moved over to Salesforce Marketing Cloud. This month will be the crossover strategy for a measure like breast cancer screening. We'll move from mPulse to Salesforce, which is our CRM vendor now for customer services, relationship, and management. It's more cost efficient, saving MetroPlus $1.3 million annually, but not compromising on quality because it allows for increased personalization, more expanded channels to communicate directly with members and for them to respond back to us, as well as real-time analytics. So we believe that this messaging strategy for things like breast cancer screening, but other mechanisms to improve redetermination rates will help the plan both increase their membership and ensure that quality is maintained through messaging our members. Happy to take any questions.
Questions?
Just on the breast screening example on site-based differences, that's pretty interesting because you have a lot of data or variation across within the system. It looks like trying to do something for everyone is hard, but trying to do something in a clinic that you already know rates are low.
Yeah, so I
It's
think
sort of like you at least have an answer on how to do it.
Well, I think we have an answer because, Dr. Pagan, it starts with understanding local issues. For example, it's geographic location of where that radiology center is, how quickly people can get to it on the day of the visit, for example, and telling people you can just go up there and get your mammogram without losing their way. We found that that was effective. We also ensured that centrally, sites that were not doing as well got the extra assistance in terms of outreach calls. And then we focused our efforts also on messaging our members through mPulse. Now it will be Salesforce Marketing Cloud to ensure that they get that, are alerted to get the mammogram. And then I do believe that the feedback loop of a member reward is also helpful. But it requires sort of each site is unique in their issues, and I think understanding each one is really, it's the local that then informs the central strategy that we've implemented.
And I had a quick question on the previous one. You thought the tier one rating, and because they look at data from 2023 and they tell you now, right?
Yeah, so what happens, yes, it sounds extremely delayed, but you'll understand. So for measurement year 2024, which we're in the midst of reporting out, we have to make sure that all the claims data from December, it takes sometimes 90 days for all the claims to come in. Then the state wants to make sure that any additional registry data is immunization registry data from citywide immunization registry is also incorporated. And then data from electronic health systems that are not linked to Epic, for example. So we get that from Healthix and the Bronx Rio. All of that data is submitted. It goes in right now. The state then takes 3 to 4 months to amalgamate that data across all plans. The Essential Plan CAP survey is for 2024 is taking place right now. It ends at the end of May. That data incorporates 20% of the results. And so it does take them a while. And then they look to see how much money they have and ensure when that award gets released.
So you do know the formula at the time that you're doing the things.
Yeah, so it's very interesting, Dr. Pagan. They announce the measures in January of 2025 after the year is complete. So you don't get to literally the first week of January. They will release the measures, so you don't get to cherry pick what your efforts will be. You have to do it across the board. And as I mentioned, 7 behavioral health measures, including discharges after an inpatient admission for mental health or substance use, and discharges from the emergency room for the same. So it is done fairly and robustly. And to see that improvement for MetroPlus when we didn't have an idea to when we did have an idea is, I think, a testament to the collective work. All achievement is shared, so it's really been a
Questions on it, yeah. Thanks.
Absolutely. Any other comments, questions? Any other old or new business before the committee? There being none, thank you all. Adjourned. Thank you.
This meeting is no longer being recorded.